Hello, everybody. This is Dr. Langdon, board certified pediatrician, mama of 6 and grandma to 3, with some answers to recent questions about parvovirus B19, which is the cause of fifth disease, which results in that classic slap cheek appearing rash on kids. It is very common. We saw an uptick of it this past summer, which is unusual. It's primarily winter and spring. We think maybe left over from some decreased immunity during COVID when we were all separated. But for whatever reason, the good news is once your child has that classic slap cheek appearing rash, they're actually no longer contagious. Now, the only time that it is a little bit more concerning is if there is a pregnant mom, mostly in the first trimester, who has never had fifth disease, who's never had the slap cheek appearing rash, and she may have had it and just not remember. But then she's exposed to a kid who does have it. That could be concerning because, let me teach you a few things. There is a relatively long incubation period, anywhere from 4 days to 20 days. That's a very random and very variable incubation period. And then once the child gets it, they can develop some symptoms like just malaise, maybe a little fever, some cough, some runny nose, that sort of thing. As that seems to be getting better, then around day 7 to 10, it's very variable, they can develop the classic rash, sometimes with joint pain. Adults are much more likely to have joint pain with this. Well, with that classic rash on the face, the bright red, feels warm to touch, cheeks, I mean, you can almost see the fingerprints. It really looks like they were slapped. They can also get this lacy reticular rash, really on their whole trunk, their whole body, but most of the time it's on the forearms and the thighs. Well, the way this virus is transmitted is through respiratory droplets, like so many other things, through blood products, or from mom to baby. So there is a very rare thing called hydrops fetalis, and that is when, very rarely, it can be fatal to the fetus if the mom catches the infection and had never had it before. So if the classic story is there's an elementary school teacher who's early pregnant, doesn't think she's had it before, and one of the kids in her class gets that classic slap cheek appearing rash. She panics. So don't panic, but do call your OB. And your OB would want to check some titers or antibody levels in you. If you've already had it before, there's just nothing to worry about. So the reason that happens is this particular virus, parvovirus B19, not the same as dog parvovirus. The dog parvo doesn't come to humans. This doesn't go to dogs. Completely different. But that virus prefers to grow in cells that are rapidly replicating, which is the case of the baby inside, of course. But also it likes erythroid lineage, meaning the bone marrow, the cells that will become red blood cells. So the other time this could be problematic is if the patient is immunocompromised, such as HIV or getting chemotherapy, or for a number of reasons that can cause an immunocompromised state. Or if the patient has a chronic anemia, like a hemoglobinopathy, like sickle cell disease, or like a thalassemia, then sometimes those kids can get very low on their hemoglobin, in extreme cases, even to the point of needing maybe a blood transfusion. But even that's not likely. So if it's a kid who doesn't have an underlying chronic anemia, doesn't have an immunocompromised condition, don't worry. And the greatest irony is once we see that rash, they're no longer contagious, because that's when they're forming the antibodies, the IgM, the earliest antibodies against the parvovirus B19, and cell-mediated immunity is kicking in, and now they should have lifelong immunity against parvovirus B19. So if that child then grows up one day to be pregnant, it won't be a problem. So almost never is the problem. Almost always when the pediatrician is involved, it's just because we're writing a return to school note because we saw the rash. We know they're no longer contagious. So I hope that answered some questions you guys have had. We have seen some of this in clinic recently, and we have forever, my entire career. This is just one of those things that almost makes us happy in that we know exactly what it is, and it's almost always good news and reassuring that they will be fine and safe to go back to school. Thanks. Hope you found that helpful.